Hello, I'm Allison Teamy, and this is a community analysis presentation for Brandon, Florida. This presentation is for community health nursing at St. Petersburg College for fall of 2020. Brandon was first settled by John Brandon in 1858 and was officially named after John Brandon in 1890 when the Florida Central and Pennsylvania Railroad came to town and needed a name for the new train depot destination. In 1927, the first gas station was built and Hopewell Road, which is now State Road 60, was paved. The 1950s marked major growth with neighboring communities around Brandon popping up. In 1970, Brandon started to spread into the bordering communities of Bloomingdale, Dover, Lithia, Seffner, and Valrico. Interstate access to the city was built in 1986 with a connection between I-4 and State Road 60. Today, most of the land within the geographic border of Brandon was developed, and the current population is 113,279 residents. Brandon, Florida is a large town with well-established businesses and neighborhoods. There are many types of housing, including new and old neighborhoods, apartment complexes, condos, and townhomes. There is a plethora of churches available for worship and numerous denominations throughout Brandon. The main occupational industries include construction, retail, healthcare, and education. The local library is centrally located in Brandon and offers ebooks, audiobooks, movies, educational life skill, and support-based classes for children, teens, and adults. Brandon has many options for small and large retail stores and food stores who offer competitive pricing. Brandon Hospital is located in the heart of Brandon and is a 418-bed facility. There are many urgent care facilities and an additional freestanding ER powered by Advent Health that is located just 0.6 miles away from the Brandon Hospital. There are two newly built healthplexes in Brandon powered by Baycare and Tampa General Hospital. They are designed to be one-stop shops for all patient care needs. These complexes offer outpatient rehab, outpatient surgery, pharmacy, primary and specialty care physician offices, laboratory services, diagnostic testing, and nutrition and fitness classes. There is no shortage of drugstores or pharmacies in Brandon, as 35 were identified in the windshield survey alone. Hillsborough County School District is the 7th largest in the state, and every high school in Brandon was ranked among the best in the state in 2019. An all-time high school graduation rate was made in 2018. 94% of Hillsborough County residents have adequate access to locations for physical activity in comparison to the 89% of state residents. There are many public parks throughout Brandon, including sports fields, walking and hiking paths, biking trails, playgrounds, and areas for social gatherings. Brandon's Recreational Center offers many different sports, activities, educational classes, fitness classes, free Wi-Fi, and senior programming. The city parks are free, and there are many free walking paths available for public use. The county parks do not require an entrance fee, and the ones that do are very affordable at $2 per car up to 8 people. The use of urban green spaces and parks has been shown to increase physical activity, reduce mortality and morbidity, improve depressive symptoms, and reduce violence. Growth of the population has far outpaced road and transportation improvements. Traffic is always heavy and congestion remains a problem. Bicycle lanes are almost non-existent in Brandon and forces cyclists to either share the sidewalk with pedestrians or the road with automobiles. Designated bicycle lanes promote an alternative mode of transportation, promote a healthy lifestyle, and add positive impacts to the environment, community infrastructure, and community well-being. Another cause of concern for Brandon include the lack of public transportation. 1.9% of the state population use public transportation as their means to travel to work, compared to just a mere 0.6% in Brandon. There is only one bus route in Brandon that is centrally located, running east to west on State Road 60. This route does not provide transportation options for people who need to travel north and south or who do not live in the immediate vicinity of the bus route. Although new housing construction is rapid in Brandon, affordable housing is still an issue for the community. Brandon has more renters compared to the state percentage, and 50% of those renters are considered suffering severe housing burden due to paying 30% more than their monthly income on rent. There are 10 low-income based apartment complexes with an additional 1,936 subsidized rental apartments available for those in low-income housing need. Research has validated a connection between housing cost burden and health, demonstrating that high housing cost burden contributes to poor overall health, poor mental health, and lower healthcare utilization. Upon observation, it is apparent that Brandon is a very urban community with a high concentration of people and development within its borders. The Brandon population has 3,126 people per square mile, making it a high population density area. In 2019, yearly births in Hillsborough County outnumbered deaths, indicating there's a continued population growth and that the population density is most likely going to increase further, leading to potential health risks related to overcrowding. This is a consideration for the future health of the community, as there's a negative correlation between high population density and health. Continued population growth of Brandon places residents at higher risk for outbreaks of disease and more severe outbreaks when they occur. The age, socioeconomic, and racial demographics were almost identical to the state percentages, showing that Brandon has a very diverse population. Brandon is a fairly well-educated town, with 88% of the population having a high school degree or higher, and 29% of the population also has a bachelor's degree. Research has demonstrated that health is a prerequisite for education, as hunger or medical issues can hinder learning, and formal education is an essential contributing factor for health. Vulnerable populations are present in the ethnic, elderly, low-income, and low education groups, as individuals who reported poor physical health in the last 30 days were highest in people with less than a high school education, less than a $25,000 income a year, over 65 years old, and in Hispanic females. The percentage of residents living in poverty in Brandon is 16.7%. These findings are particularly important given the fact that poverty is one of the strongest predictors of health. In correlation with the poverty rate, 70% of Hillsborough County residents did not see a doctor due to cost in 2016. The Suncoast Community Health Center is a wonderful resource for the poor in Brandon. This is a federally qualified medical facility that provides medical and dental care to low-income families. The statistics clearly show that there is a lack of availability of health and dental care for low-income families in Brandon. 12.7% of Brandon's population comprises seniors age 55 and older. 32% of Brandon seniors reported fair to poor health compared to the 24% in the state of Florida, showing that there is an increased need for medical services for this population. Studies have shown that insufficient insurance coverage, rising healthcare costs, and widening disparities in access to healthcare services have adversely affected the elderly population in the United States. On any given night, there are approximately 1,650 homeless people in Hillsborough County. Brandon really lacks nightly shelter resources for the homeless, leaving the homeless in Brandon in unsafe, unhealthy, and stressful sleeping environments. The closest emergency nightly shelter is the Salvation Army Shield Lodge. It is open 365 days a year and is welcome to walk-ins. However, it's located in Tampa, over 10.5 miles away. There are two main community outreach programs named ECHO and the Family Promise of Greater Brandon that help homeless families and individuals regain independence, providing shelter, basic needs, and employment assistance. However, their acceptance process into the programs and shelter is not immediate. There are numerous church-led food pantries, clothing drives, and collaborations between the churches in Brandon and community outreach programs that provide homeless and hungry with food, clothes, and essential needs. There is a direct connection between the deterioration of physical and mental health and homelessness. Overall, there is a moderate amount of resources available for the homeless, and efforts to improve homelessness has reduced the homeless population by 12% in the last year. However, there is not enough immediate shelter for those who are in sudden or chronic housing crisis. The number one cause of death in Hillsborough County is heart disease, and modifiable risk factors seen in the population contribute to it. The number one cause of death follows the national trend, as heart disease is also the top cause of death for the entire country. 66% of adults are overweight or obese, and this is just slightly better than the entire state of Florida by 2.9%. The sedentary rates were slightly worse than the state by 2.2%, and the tobacco use rate was slightly worse than the state by 1.5%. Alcohol-related deaths for Hillsborough County are high at 27% compared to the 23% for the state, while reported binge drinking is also higher in Brandon than the state. Alcohol abuse and misuse disorders present a significant threat to public safety, as these statistics may be a reflection of the need for more mental health services and substance abuse professionals in the area. On first look, when performing the windshield survey, there appears to be a plethora of private and insurance-accepting facilities. This observation is supported by the fact that Hillsborough County has a higher number of licensed dentists and physicians compared to the state. Even though Brandon has a higher rate of physicians and dentists than the state rate, the overall Brandon area was ranked a primary care health professional shortage area for primary and mental health care physicians. A community health needs survey was conducted by Hillsborough County in 2019, where 2 in 5, or 37% of respondents, reported having unmet health needs during the past 12 months. As the population continues to grow, there is a displayed need for more physicians in the area, as only 66.5% of Hillsborough County residents have an established doctor, and only 72.3% of adults have had a medical checkup in the past year. For seniors, there's a good amount of care, including nursing, skilled care, and rehab facilities. Brandon Senior Center provides transportation services, meal delivery, adult daycare to home-restricted residents. Hillsborough County Senior In-Home Care Services provides medical supplies, personal care, emergency alert devices, and home-delivered meals for low-income or disabled seniors. Services are based on sliding scale or are free. The Sunshine Community Health Center provides comprehensive primary and secondary care to low-income or non-insured senior residents. For the insured population, there's a wide range of accessible care facilities for all medical needs throughout the town. For the uninsured or low-income populations, there are 11 free or income-based medical clinics offering primary, secondary, substance abuse, medical health, vision, or dental care in Tampa. Many of these clinics offer specialty care such as ENT and dermatology. There are some potential barriers to care for these facilities, however. Some are first come, first serve. Some clinics have limited hours, some have limited days for appointments, and some clinics have a limited number of appointments available or long wait times. Hillsborough County's Sunshine Line provides transportation for vulnerable populations such as low-income, elderly, and the disabled. However, coordination of appointments and free transportation could be a challenge, as the transportation is based on need and also on a first-come, first-served basis. Lack of awareness of services could be one barrier to the utilization of community health resources, as the author of this presentation has lived in this county for 20 years and never heard of any of the services or programs that were researched during the making of this presentation. In order to be utilized by the community, healthcare has to be acceptable and compatible with the values of the community members. With over 50% of Brandon's population being of ethnic origin, there is a large area for potential communication and cultural barriers. Clinical barriers between patient and provider interactions can be seen when linguistic and socio-cultural differences are not identified, accepted, or understood. It is not clear if translation services are provided at all low-cost clinics for patrons who do not speak English or understand English well. These barriers can lead to mistrust, dissatisfaction, decreased adherence, and poor health outcomes and health disparities. There is a plethora of medical offices, urgent care facilities, a hospital, and pharmacies in Brandon that accept most insurances, Medicare and Medicaid. This makes medical care affordable for the 87.3% of the insured population. For the uninsured or poor, there is one federally qualified health center. The Sunshine Community Health Center, located in Brandon, offers medical and dental care. The Sunshine Community Health Center has several other locations in nearby Tampa as well. All fees are based on a sliding scale, and this health center provides pediatric, adult, dental, primary medical care, x-rays, lab services, family planning, obstetrics, breastfeeding support, and pharmacy services to the community. Objectives important to the population of Brandon include access to health services, mental health, and nutrition and weight status. Better access to health services is important to Brandon, as only 87.3% of the population have insurance, and 17% of the population did not see a doctor at least once in the last year due to cost. Black and Hispanics reported having greater unmet health care needs in comparison to whites in Hillsborough County. Improving insurance coverage, availability of services, and timeliness of care helps to remove barriers of care and promotes health and management of disease. Several areas throughout Hillsborough County are medically underserved in mental health providers. Hillsborough County has a lower number of mental health providers compared to the state, at 560 people per one mental health care provider, compared to the state's 620 to 1 ratio. The Brandon Riverview area specifically would require 5.8 new full-time mental health providers before it would achieve the target population to practitioner ratio. Poor mental health is a risk factor for many chronic physical conditions and can impact the quality of life. Therefore, meeting the mental health needs of Brandon's population would improve the health of the community and reduce the disease burden. The nutrition and weight status objectives reflect strong scientific research showing that the health benefits of eating a nutritious diet and maintaining a healthy body weight. This objective would be highly beneficial to Brandon considering the top 4 causes of death in the county are influenced by weight and poor nutrition. Weight and nutrition status is important to Brandon considering 63% of the adult population is overweight or obese. Obesity costs the U.S. healthcare system $147 billion per year. Brandon's safety is adequately protected by Hillsborough County Sheriff's Office and the 43 fire stations serving the county. Violent and nonviolent crime rates are all lower in Hillsborough County than in the state. In the 2019 Community Health Assessment Survey conducted by the Florida Department of Health in Hillsborough County, 79% of respondents reported that they feel safe in their neighborhoods. The safety of Brandon is working in the favor of the health of its community members, as public safety is a social determinant of health, and the chronic stress of living in unsafe neighborhoods can accelerate aging, cause anxiety, depression, and lead to poorer health outcomes. Air quality in Brandon is monitored daily by the Hillsborough Environmental Protection Agency, and readings trended in the good range 22 out of the last 30 days. Water quality is also routinely monitored by the Environmental Protection Agency. The county treats water sources, including rivers, lakes, and streams, to make safe for drinking. Fluoride is added to the water in Hillsborough County in efforts to reduce caries development. The nearby port of Tampa does pose a potential risk to the community water supply as it houses liquid petroleum products, sulfur, and ammonia liquids. During observation, Brandon had an overall pleasant, clean, and well-maintained appearance. The county maintains the grass and trees and road medians and swales. Roadways are well lit and in good condition. Weekly trash service provides disposal of waste in a timely manner for the community. There are very few vacant storefronts or buildings, and neighborhoods appear well groomed. There are minor issues with trash dumping in the parking lots and on streets. However, this is not enough to distract from the positive features of the community. There are 7 county commissioners serving 7 districts in Hillsborough County. Brandon's geographic boundaries are split into District 4 and District 2. Stacy White oversees District 4 and Ken Hagan oversees District 2. Residents can easily find all contact information for the commissioners as it can be located on the Hillsborough County website. Commission meetings are required to make new community policies and provide county residents an opportunity to speak about issues of concern. Meetings can be attended by the community members via video due to COVID, and previous meeting information can be obtained via the county website. Commissioners work to adopt the county's annual budget, and the county's budget allocates for all essential services needed to keep Brandon's infrastructure working and keep residents safe. The budget allocates for transportation improvements, public works, enhanced public safety, sustainable economy, social services, and recreation. Based on the data extracted for the community assessment of Brandon, Florida, there were no economic, political, or public policy concerns identified. 6 community problems applicable for Brandon include the need for affordable housing, designated bike lanes, increased public transportation, lack of awareness for available health resources, lack of mental health care providers, and lack of homeless shelters. The lack of affordable housing was placed as highest priority because high rents and housing costs divert money away from healthcare needs and food. Locations with high housing cost burden have more children in poverty, food insecurity, and people in poor health. The lack of bike lines in Brandon puts pedestrians, motorists, and bikers at safety risk and health risk. Lack of bicycle lanes deter an alternative mode of transportation that is healthy, good for the environment, and benefits traffic congestion. Therefore, it was placed second in line as priority as it benefits the community in multiple ways. The lack of bus routes in Brandon leaves commuters without options for public transportation. Increased public transportation would provide a safe, inexpensive, fuel-effective method of transportation that reduces traffic congestion. Public transport would better facilitate access to stores, healthcare, and increased mobility of individuals and families without vehicles, placing it third in priority. It was identified by key informants in the 2019 Community Health Assessment Survey conducted by Hillsborough County Health Department that lack of utilization of health resources for the poor was due more to lack of awareness than lack of resources. There are no public advertisements for the services or facilities that provide important preventative and primary care to the community. Because the resources are already available but awareness is lacking, the need was placed as fourth. The fifth community problem applicable to Brandon was the lack of mental health care providers. Because there are already some providers for both insured and uninsured population, this problem was given a lower priority. The homeless population of Brandon is small but nonetheless important. Therefore, the lack of homeless shelters was placed as a final priority. The current situation requires individuals and families in sudden crisis to travel over 10 miles to the closest shelter. Providing this population with safe sleeping conditions provides security from vulnerability and victimization that could occur on the streets. This concludes the community analysis. I hope you enjoyed the presentation and visit Brandon, Florida if the opportunity arises.